Hi everyone, I'm Steve, here again with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. You can check them out online and see what kind of treatments they do and what they have to offer there. So, hello, doctor.
Hi, Steve. Thank you for having me again.
Okay, so let's talk about the gut today. How about small intestines? Now, what is small intestinal bacterial overgrowth?
Well, Steve, this is, again, something undetected for a lot of people. It's always about the questions of answering, like, do you have any unknown bowel movement symptoms that you can't put a finger on, or even your doctor, or an IBS diagnosis that was just given to you because they can't think of anything else, or your doctors can't think of anything else? This might be the problem that you might have. The definition of small intestinal bowel overgrowth, or what we call SIBO as an acronym, is defined by the presence of abnormal and excessive number of bacteria in your small intestines. The symptoms with the bacteria being there would be majority, or the most common one would be bloating, gas, abdominal pain, nausea, dyspepsia, or more of burping and acid, even fatigue, diarrhea, and constipation. The thing here, most common, is bloating. I mean, it's really bad when you have this type of condition. And you have to remember the microbes or the bacteria are not uniformly distributed along the GI tract. And the differences really are because of the diversity of bacteria can be related to the nutrients in the stomach, in the small intestines, and even the large. They're all different. And also the pH. That's why bacteria prefers to live in this specific area of the tract rather than the others. And again, the lowest abundance would be more in the small intestines compared to the colon. Colon is when we take probiotics, that's where it goes, that's where they populate. And differences in the types of microbes present in the small intestines and the colon is very large. That's why you always want to think of the small intestines to be, oh, nobody can go there. It's very pristine, it's very clean, it's hard to colonate. And colon, one of the dirtier ones, that's where bacteria is more prominent. So when you have these symptoms that I just mentioned, your doctors or even you might think of, it might be IBS. So it might be, and IBS might be also related to what we call leaky gut. So all of these now are overlapping. But one of the main heart of the problems of these triad is SIBO. So increased microorganism levels in the small intestines and leading to these majority of symptoms that I just mentioned. And I see a lot of these now in the clinic. That's why I brought it up so that people can be aware of it a little bit more.
So what causes this?
So good question, Steve. Majority of the problem, I want everybody to think that there is an imbalance in the small intestines in relation to the bacteria. As I mentioned to you, there should be the low count of bacteria over there. Now there's more people in the party that are uninvited. It's the sanctuary of cleanliness of our gut. And with this microbial activity, the party that's going on there now produces fermentation, especially when food gets in there. So they produce gas and byproducts when they eat food. Thus, as I mentioned, gas and bloating is the most common sign for this, even in patients who eat healthy diets. And here's the thing, here's the biggest clue if you have SIBO or not. You have the intolerance to healthy foods, such as when you take your probiotics, when you take fermented food, such as kombucha, sauerkraut, or kimchi. These are typical that they should help the gut, right? But in SIBO cases, it's going to aggravate the symptoms. Other causes can be overuse of antibiotics, wherein antibiotics kills the good bacteria and promotes the growth of the bad. Another one is reduction in the key GI support factors, such as fiber, especially when you're a lot of meat in your diet and low on the fiber count. As we all know, food fiber is good for the production or repopulation of good bacteria. When you also have poor motility, or you don't move a lot, meaning you're constipated because of a low fiber diet, or you're just sedentary because of quarantine, you're not moving much. So there is also a slowdown that leads to a backflow of large intestinal bacteria into the small intestine. So you have a long line, and now it's so long that the line is crossing other properties, which is not yours. And another one is that commonly occurs when the passage of food and waste products in the small bowel slows down. Of course, when this happens, the breeding ground for bacteria of undigested food will be there.
Okay, so if you have these symptoms, I mean, how do you know? How do you diagnose this issue? SIBO,
Well,
how do you diagnose it?
SIBO, yeah. Well, the thing here, Steve, is it's very hard to diagnose this. The gold standard of diagnosis of SIBO is aspiration of samples in your small intestines. It's the gold standard, but you have to remember it's invasive because you go in there, you put a scope, you get a sample. And even with that invasiveness, you may still miss if you got the sample, an inadequate amount of sample. Meaning, I mean, it's still a hit or miss, basically. Another test would be the breath test. So the breath test is you breathe into a tube and you test for methane or hydrogen sulfide gases that are created by the bacteria from fermentation. And again, some inaccuracies because of the testing measures and how they're made. Another one is studying your stool as well. They're going to dissect that stool to look for like methanogens or remnants of these gases. But again, these are very hard to and time consuming to do. And some of them are not even covered by insurance. That's why majority of my patients are getting diagnosed with signs and symptoms, which is subjective. Again, going back to bloating, especially when you eat healthy food or fermented food, prominence of diarrhea and constipation, and also when you're methane dominant, meaning the gas that was emitted, you're mostly constipated if you have that. And you heard about the FODMAP. I'm sure everybody heard about it. It actually resolves with a FODMAP diet. And again, when we talk about diagnoses, I still want to be on the side of using the objective test, either a breath test. That would be good for me. It's hard to just treat somebody with SIBO without any evidence. That's why you need your professional to go along with you.
So what's a FODMAP diet?
Yeah, so Steve, FODMAP diet is something that's very famous for, I'm sure people know somebody who has IBS, who has leaky gut. So it stands, so get ready for this one, stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. I don't want you to remember that, but just remember FODMAP. And these are what we call short chain carbohydrates or sugars that the small intestines absorbs poorly. That's why we need to avoid that, because it causes more fermentation. Some people experience digestive distress after eating these food choices. It's thought to contribute to symptoms of IBS and other gastrointestinal disorders. And this is, as I mentioned to you, is also used in SIBO management. It may or may not work. A good example for you, which is pretty hard, especially for you, you're a healthy guy, you're going to avoid avocados. Even it's known to be healthy, but it may still promote fermentation. Another one, I use this too, the xylitol, the erythritol, the healthy sugars. When we think it's healthy, but for people who has SIBO, this can actually be fermented because it's a sugar alcohol. That's why it's hard to avoid FODMAP recommendations. So for the viewers, you can just Google this anytime and you'll get a full list of it.
Okay, so what about treatments? What do you do about this? Is there anything? I mean, what?
Yeah, so this is the challenging part, Steve. Well, again, emphasis on treatment for SIBO is, of course, SIBO may only be one of the problems that I mentioned to you. It can be leaky gut, it can be overgrowth of bad bacteria. So you have to consider even fungal overgrowth. I mean, that's the worst part of everything. You have to consider these other diagnoses as well. But let's go to the conventional part on how they treat this, on how we treat it also. There's an antibiotic called rifaximin, and it's taken for 14 days, and it's a non-absorbable type of antibiotic, and it only stays in the gut, and it's not getting absorbed in the blood, and it just stays there. It kills everything that's in that gut. So overgrowth, bad bacteria. Side effects, though, here's the caveat: nausea, gas, cramping while you're on the medicine. Again, the assurance 50-50, 60-40 maybe, may or may not treat, and relapse is still very prominent, especially if there are other causes, like especially after rifaximin, we kind of see fungal infections that grows afterwards that you need now to treat another headache for you. But let's go to the integrative or alternative methods of treating it. You have to treat the source. What is the source? As we always talk about, the diet, the stress, the lifestyle. If we can treat that, we're going to be doing a lot of good things for the gut. But being specific, there are two, modalities that we can use. It's called spore biotics. This is different from probiotics. It's more of an upgrade. These are probiotics that are enclosed in a capsule, and it's almost like a bomb. When you drop it, and it needs to work on a specific area, then it opens up and then releases the bacteria, the healthy bacteria, to fight the bad bacteria. And in this specific situation, it's in the small intestines. So it's like dropping a bomb, and then it's going to go there immediately, like a heat-seeking missile. And again, when I mentioned about the other treatment is bovine immunoglobulins. Bovine immunoglobulins, they're like binders. So you take it in, you're going to bind all the toxins in your gut, and then you're going to poop it out. So it's almost like a blocker, and it disposes of the evidence or the bacteria, the toxins, through the stool. That's why it's still important to have normal bowel movement schedules. And in our facility, we give oxidative therapies such as hydrogen peroxides, ozones, to destroy those bad bacteria that's in the gut. And that also hastens the healing of the GI tract.
Wow, yeah, and I know those are two good treatments. Okay, well, thank you, Dr. Nario, Biointegrative Health Center. If you have health questions, I would suggest that maybe you reach out to Biointegrative Health Center and see what they can do for you. Thank you, Doctor.
Thank you, Steve. As you all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.